Cancer is a continuously growing global health problem that poses major challenges, most especially in developing countries. Find out how this international distributor of innovative health products came up with a series of solutions to help increase a patient's chance to survive the odds. In 2020, the Philippines hit a record of 354,398 prevalent cancer cases within a 5-year period. But because of poor access to health care, especially for people living below the poverty line, the advances and breakthroughs in cancer remain unattainable to many.
Cancer refers to a group of diseases that's characterized actually by cell growth, abnormal cell growth and proliferation, inflammation, as well as angiogenesis or formation of new blood vessels. It always starts with mutation in the genome or the genetic makeup of a person inside the cell. Before 𝘂𝘊𝘆, most of my patients, they were unable to finish the chemotherapy regimens because of the side effects and because of discomfort during the process of chemotherapy.
Maria's son, Dominic, was diagnosed with stage 4 𝘓𝘓𝘪𝘳𝘵𝑜𝘪 when he was only 4 years old. While coping with the recovery of her other sick child, Maria found it hard to accept Dominic's condition.
It was actually very devastating kasi with Dominic, it was manifested mga 4 years old na siya eh. Unlike dun sa daughter ko na congenital talaga, baby pa lang. Yung mga bandang September, meron ng umuumbok-umbok dito sa leeg niya. Hindi ko talagang inisip na cancer kaagad siya until nag-nosebleed siya.
Dominic was prescribed chemotherapy, but his family insisted to rush to an integrative doctor to seek for alternative cure.
Medyo hesitant ako kasi as a mother, I know the side effects ng chemotherapy kasi. So what I did is that I rushed towards the integrative doctor of my daughter, who happened to be 𝘂𝘊𝘆 partner doctor of Simply Nature.
One of the hardest decisions to make for people living with cancer is choosing the kind of treatment that would work best. To help patients and their families deal with this growing health problem, one company commits to producing safe, credible, and natural health solutions by drawing on the latest bioscience technology to deliver a series of safe, efficient, and natural products. What is Simply Nature and what does it do?
Simply Nature is a company we created and founded about 10 years ago. Our mission is to find effective health solutions for people. So we provide natural products that work in combination with conventional therapy and medicine.
As an international company that provides natural solutions for cancer, metabolic syndrome, and degenerative diseases, the management upholds a health philosophy that centers on whole food nutrition as the frontier in health management.
When we talk about choosing treatment, especially in the area of cancer, patients are really afraid of chemotherapy because of its side effects, and they tend to then look towards natural products. But this is not either conventional or natural choice. At Simply Nature, patients can have the best of both worlds. Our protocols work with conventional chemotherapy to minimize its side effects so that they can get the best treatment using both conventional and natural together.
Cancer is like a virus. It continuously evolves, it mutates, so it can develop defenses against our usual treatment modalities like chemotherapy.
Like I said, chemotherapy and radiation therapy have a lot of side effects. So more often than not, patients stop their treatment because of these side effects. It's very important to have the support.
With the supplements that we give the patients, there will be lesser side effects, so they will be able to finish their chemotherapy protocols more comfortably.
This company introduced 𝘂𝘊𝘆𝘧𝘕, which is touted as one of the best natural ways of solving serious health problems.
𝘂𝘊𝘆 stands for peroxisome proliferator activating receptors. It's basically a nuclear receptor found inside the cells. Now, when these receptors are activated, the benefit that you can get from that is, number 1, cellular differentiation. Number 2, it's to promote fatty acid metabolism. If you have better insulin function, your blood sugar will naturally go down. And another one is to induce cancer cell death by modulating the immune system.
As a sole distributor of 𝘂𝘋𝘴𝘆, the company promotes its use to many reputable health institutions worldwide and actively organizes corporate health conferences and public health talks in Asia.
𝘓𝘓𝘧𝘴𝘶𝘂𝘶 is made out of a special strain of these types of microalgae. It is very effective by protecting the bone marrow. We maintain the integrity of the immune system of the patient, which is very important to prevent infections and to fight off the cancer itself. And also, 𝘓𝘓𝘧𝘴𝘶 is also very dense in nutrients so that the patient can recover faster because of better cellular healing.
Sabi ko parang na-lead kami to an extraordinary and I must say amazing journey. I'm very proud of him. At a young age, na 8 years old, he believed that it's his purpose to siguro encourage other people then. We would like to really pay it forward with the knowledge that there's really like Simply Nature that can help people with cancer very much.
When fighting cancer, living healthy is very important because it allows us to pursue what is important to us in life, and that's what it's all about. When we can help a patient move from being bedridden to getting up, to be lucid in thought so that they can have conversations with their loved ones, it gives the whole process of fighting cancer a whole new meaning. And that is what drives us at Simply Nature.
Talagang sobrang sakit. Sumusuka na ako. Tapos sa work ko rin, hindi ko na kaya talagang mag-isip. Dumating ako sa point na nawala na din daw ako ng malay. Then, nakilala ko si Sir Shyan. Meron silang ganung product. Effect sa akin ng supplement na to is malakas ako. Kahit nagkikimo ako, nag-radiation ako. Hindi ko naranasan yung mga naranasan ng other patient na nagsusuka, nanghihina, walang ganang kumain. My name is 𝘓𝘓𝘧𝘵 Gomez, 48 years old. I live in Quezon City. Currently work is a property manager. Diagnosed sa akin is breast cancer no year 2019. After 2.5 years, is recurrent na siya for stage 4. Affected na yung brain, then lungs and liver. Kumalat na siya. Yung symptoms na naramdaman ko is talagang sobrang sakit ng ulo ko. Gumising ako, parang sumusuka na ako. Tapos yung umiiba-iba yung way ng walk ko. Talagang as in, vomit dito, vomit dun. Tapos sa work ko rin, talagang hindi ko na kaya talagang mag-isip. Parang lagi akong masakit talaga ang ulo. Na dumating ako sa point na nawala na din daw ako ng malay. Sabi ng mga kasama ko doon. Inaakay na nila ako. Then, yung pinakamatindi is yung dito na sa bahay na talagang inaano ko nung husband ko na ginigising ako pero talagang ayaw kong gumising. Kaya dinala na niya ako ng ER. Tapos doon na sila nag-test. Nagising na nga lang ako, nasa room na. Parang minuto na nga lang, wala na ako. Kasi talagang yung namamagana, swollen niya yung brain ko. Nang ma-diagnose ako ng 2019 na I have a tumor, bukol, hindi ako nagpa-chemo. Basta it's natural, concentrate ako sa natural. Then, after ng 3 months, sabi nila, is kailangan ko na daw ipatanggal. So, hindi na siya babalik. So, pumunta ako ng hospital, natanggal naman siya. Then, still, natural pa rin na product na aking tinitake. Pero, bumalik siya. Stage 4 na. Kasi nga affected na yung brain ko, lungs, liver. Actually, may ano na siya, sign na para sa bone. Yun yung mga nakita sa CT scan ko. Then, nakilala ko si Sir Shyan na meron silang ganung product, 𝘂𝘋𝘴𝘆 na powder and tablets. Yun yung trinay ko habang nag-start na ako ng radiation ng 18 May, nag-chemo na ako. Natapos ko yung radiation ko for 10 session. So, okay yung effect. Nakayanan ko siya. May, nag-start na rin ako ng chemo para dun sa lungs and liver ko. And yung abdominal, kasama na rin siya. Every 21 days, 3 days yung aking chemo. With the help talaga nung Simply Nature, hindi ko naranasan yung nakikita ko sa mga kasabayan kong nagkikimo na nagsusuka, sumasakit, giniginaw, may mga ganun, tapos parang hindi talaga sila makakain. Minsan nga, hindi nila natatapos yung treatment nila. Pero ako, natatapos ko siya, is 3 days pa, na ang recommended sa akin is dapat naka-admit ako ng 3 days. Since tight lang din ako sa budget, is nag-decide na lang ako mag-uwian. Kasi strong ako, kaya ko. The following month ulit, nakaya ko siya ng hanggang 5 cycle. Di ako nagsusuka, nagugas ng plato, may konti akong pinagkakabalhang tindahan. So, nagagawa ko. When I was diagnosed sa stage 4 cancer, I cried, of course. Hindi mo naman may iwasan yun. Pero I never felt na hindi ko kakayanin. Parang kailangan ko lakasan ng loob ko para sa family ko, lalo na sa mga bata, sa mga anak ko, maliliit pa sila. Yung husband ko, naiyak siya, syempre. Pero nung makita niya akong lalaban ako, parang nadagdagan yung fighting spirit niya na talagang lalabanan natin to, mami, sabi niya gano'n. Narinig ko nga sinabi ng doktor na less than a year ako, pero hindi ako kinabahan. Tinitake ko is 𝘂𝘶 powder, 2 scoop, nilalagay ko siya sa ilalim ng dila para ako matulog. Then 15 tablets every morning, empty stomach. Then sa afternoon din, 15 din ulit. Bumibili rin ako ng cleansing para panglinis. During chemo, radiation, ginagamit ko siya. Effect sa akin ng product, ng supplement na to is malakas ako. Kahit nagki-chemo ako, nagre-radiation ako, hindi ako nanghihina. Kaya kong bumalik sa normal na kilos ko after ng chemotherapy ko. Happy ako sa mga result kasi after 3 months, pinag-CT scan na nga nila ako at saka MRI. Good yung development. Nabawasan lahat yung mga measurement. Siguro yun yung effect talaga ng supplement na tinitake ko. This month is naka-evaluation. PET scan na po ako. Happy ako dun sa result ng CT scan at saka MRI. Kasi nga, yung sa MRI ko, yung sa brain is from 1.09 naging 0.08 na lang siya yung measurement niya. Then yung sa lungs ko, which is yung chest scan ko, is 9.05 naging 4.05 na lang. I will recommend Simply Nature to other cancer patient kasi it's very effective for me. Kahit nag-treatment ka at tinitake mo yun, hindi ko naranasan yung mga naranasan ng other patient na nagsusuka, nanghihina, then walang ganang kumain. Hi, I'm 𝘓𝘓𝘂𝘓𝘓. I have stage 4 breast cancer, metastasis for the brain, lungs, liver, abdominal, and bone. Thanks to Simply Nature, I'm okay now. And I trust Simply Nature.
today mga ka-Simply Nature! My name is Jenny Ray and you are watching another episode of Simply Nature webinar powered by SMG or Simply Healed Medical Group. Before we embark the topic of cancer care journey, I'd like to welcome each and every one of you. Please feel free to introduce yourself in the chat box or comment section below. Let us know where you're watching us from. We have registrants from all over the Philippines, also from Malaysia, Ireland, and the Caribbean. This is a free webinar, so if you have relatives or friends with cancer, feel free to share or tag them. All right, now I'm sure you can't wait to discover 3 stages to triumph against cancer. Joining us is a seasoned international speaker on a wide range of topics from personal success to healthcare, who is also the founding director of Simply Nature International, our 𝘂𝘶𝗴𝘏 expert from Singapore. You all know him. It's no other than Mr. Shyan Lim. Good evening, Sir Shyan.
Good evening, Jen. Thank you for that wonderful introduction. Thank you. And Jen is our resident pharmacist, right? She's actually a licensed pharmacist. So, well, a big welcome to everyone. Today's topic is really, I guess, easy to apply, right? It's about how to successfully go through the different stages of fighting cancer. And Dr. Jansen is so appropriate for this topic because he deals with supporting cancer patients through chemotherapy, through their surgery, and also for patients who wanted to go through fight cancer naturally. So he will be able to share with everyone all the different types of approaches to cancer and the different stages and how you should go about it. And stay tuned all the way to the end. I don't think the presentation is too long by Dr. Jansen, probably around 17 minutes. And then we will go to our usual AMA. That stands for Ask Me Anything. So it's not restricted to cancer, although I'm quite sure tonight people will ask a lot of questions about cancer. Please feel free to ask us specific questions, for example, the drugs that you're using. And you can even ask us any other topic from kidney renal failure to liver cirrhosis to atopic dermatitis, eczema, psoriasis, diabetes, metabolic syndromes. You can ask questions about the drugs that you're using. If you're not sure why your doctor prescribed a particular thing, a particular drug for you, feel free to ask. If you have any questions about your health, feel free to ask. All right. So enjoy tonight's presentation by Dr. Jansen, and I will see you at the AMA segment. So I'll hand the time back to Jen.
Ayaw. On mo video ko, sir. Okay, thank you, Sir Shyan. Now it is time to hear from another expert. Dr. Jansen Calalan graduated from St. Luke's Medical Center, College of Medicine in 2016. In 2019, he was conferred as diplomate of not only the Philippine College, but also the International Board of Lifestyle Medicine. He is also the president of SMG, or Simply Healed Medical Group, and a consultant at Alta Integrative Medicine and Wellness Complex at 𝘂𝗶𝗏𝗏 Medical Center Las Piñas, where he manages patients with cancer and metabolic illnesses. Let us all watch this.
Hi everyone, welcome to another episode of Simply Healed, and together with Dr. Jansen with me today.
Hello, Shyan. Hello, everyone. Glad to be here again, and welcome to another episode of Simply Healed.
So tonight we're going to condense everything that Doc has ever advised about cancer and put it into a 10-minute, just 10-minute
10-minute video
guide.
okay?
All right. So today we're going to cover the cancer journey, the best practices, what to do at every point of the cancer, so that tonight you have a good overview of how to treat cancer.
Yeah, okay, so without further ado, let's start.
Guys, it's so exciting tonight because Dr. Jansen is going to share the complete approach to treating cancer. And that's important because, you know, cancer has different phases. You know, there's a phase where you discover I have cancer. Then there's a phase you go for surgery. There's a time you go for chemo. And then after that, don't do anything anymore. Then suddenly, 6 months later, my cancer came back. And that's a whole new different journey with cancer. Doc, please share with us the whole cancer care journey that you have formulated.
Okay, so the cancer care journey, well, since it's a journey, you know, so it's a process. Okay, so we have the early phase, the surgery, the treatment phase, no, and then the relapse prevention phase. Okay, so the early phase is when you feel symptoms or you get screened and you get diagnosed with cancer. Okay, so at this stage, okay,
What should we be doing?
what should you be doing? Okay, so number one is you have to take action, you have to move because time is against you. Okay, because cancer, the more that you prolong treatment, the worse that it can get. Okay, the higher the chance that it metastasizes or it worsens.
So the worst thing that you can ever do to cancer is
To delay.
to delay and pretend and
Yes.
hope that it gets better on its own.
Please don't do that. Okay,
Alright.
you have to take action. If diagnostics are necessary, please do them. Okay, because the diagnostics will determine what type of procedure you will undergo next in the next phase or the treatment phase. Okay,
So the diagnostics is to help your doctor know what is the best protocol for you.
yeah, or to know to help your doctors know what to do to you or what to recommend to you. Okay, so aside from that, aside from the diagnostics, you already have to change your lifestyle. You have to eat well already at this point in time because why? Cancer is actually a genetic problem. Okay, so there were some alterations in the genes, and so the cells were multiplying relentlessly or multiplying unheeded. Okay, so they just multiply and multiply and multiply. That's why you feel that tumor, and that tumor is growing. It's because of unregulated cell growth. Okay, so if it's a problem in the genes, then you have to change your lifestyle because lifestyle has a big influence on our genes. Okay, so depending on how you are living on your lifestyle, genes can be turned on and turned off. Okay, and also you already have to undergo ppar agonist therapy as well because ppar agonists are gene activators. Okay, okay, so it has a big influence on the manifestation, or not really the manifestation, or it's more on which genes gets activated. Okay, now in the overall picture, if you do this, it is already addressing the root cause of the problem. Okay, which is the genes. Now, it shouldn't stop there because even though you address the root problem, you still have that headquarters of the tumor cells. Okay, so you have to remove that, which goes to the treatment phase. Okay, so we're going to discuss the treatment phase next. So here's another important factor, no, for the early phase. The lifestyle modification that you are going to be doing is forever. That is lifelong, perpetual. Okay, that is forever.
So that's why a lot of cancer patients get a relapse because they don't commit to a lifelong change.
Yes. So we have lifestyle modification. It's not diet because dieting is temporary. This is lifestyle, which is forever. This is how you will live for the rest of your life in order to prevent from your cancer from ever getting back. Now, let's go to the treatment phase. So the treatment phase more or less can range about a few months to 5 years. Okay, so it depends on what type of
Cancer.
treatment or what type of cancer you have, or yeah, what type of treatment you're undergoing. If it's surgery, then of course it's just going to be a day, right?
Yes.
If if the tumor is removed, then that's it. Okay, that's it for the surgeon. Now, you will be referred to the onco already, who will be prescribing the chemotherapy, the radiation therapy, the immunotherapy as well, okay, or the hormone therapy. So one of these. Now, how long do these treatments last? For chemotherapy, it can take months. Okay, months to years, in fact. Okay, so I have had some patients who have been on chemotherapy for 1-2 years. Okay, which is really long. I mean, that's a pretty
Yeah, that
very
sounds
long time.
long. I thought it would be over in 3 months. Yeah.
Yeah, it's a very long time. And some patients undergo only 6 cycles, which can be done after a few months. Or yeah, okay, so that's for your chemotherapy. For radiation therapy, it can last for a few weeks. Okay, so some protocols would range around 10 days, which is the shortest. 10 days is like for brain radiotherapy, no? And then the other one is they fractionate it, so you get a little bit of radiation every session. So usually it can last about 5 weeks, yeah. Okay, so that's the range of radiation therapy. Okay, next is immunotherapy. Immunotherapy can be on it for 2 years.
Wow.
It's going to be a longer period of time. Okay?
So that makes immunotherapy pretty expensive because it's already expensive,
Yeah.
and you have to do it.
Exactly, for
For a
a
long
very
time.
for a long time. So 1 dose of immunotherapy, since this is a newer, it's more novel. That's why it's more expensive as well. Okay. Then another one is the hormone therapy. The hormone therapy can be years. Give you an example is tamoxifen. Women who are on tamoxifen can be on it for 5 years. Okay, just like my grandma. Okay, my grandma is a breast cancer survivor. She was on tamoxifen for 5 years. Okay, and some of you have prostate cancer as well. You can be on hormone therapy as well for this amount of
Extended amount of time.
years. So once you have already finished your treatment period, you are on remission. You
Yeah.
are cancer-free.
Cancer-free.
The next goal is to prevent it from happening again. Okay, which goes to remission phase or relapse prevention phase. Okay, so this immediately begins after treatment. But the things that you do here should already be beginning when you got diagnosed with cancer early on in the first day. Okay, or in fact, much better, if you know you have a family history of cancer, you should already be doing these lifestyle changes.
Today,
Yeah.
without even
Today.
having to wait
Okay.
for any cancer to
Yes.
appear in your life.
Don't wait for cancer to appear in your body, or don't wait for you to get diagnosed with cancer. Okay? So how do I approach remission, or how do I approach relapse prevention? Again, it's lifestyle modification, plant-based diet. You have to exercise, you have to rest well, you have to go on 𝘂𝘂𝘴𝘆 protocol, a maintenance protocol for with 𝘂𝘂𝘆. Okay?
And the good news about the 𝘂𝘂𝘆 protocol is that it will also help with diabetes, high
Yeah, a lot of
cholesterol.
metabolic
So
issues as well.
you even I am not a cancer survivor because I never got cancer. I'm on 𝘂𝘂𝘆 protocol. So that's just to make sure that I have anti-aging and look young, so that I look like a brother to Dr. Jansen, but actually I'm old enough to be his uncle. All right, so it's a win-win situation. All right, so that's something you would do anyway.
Okay, so if you are in one of these phases and you are feeling frustrated, why is it taking so long, right? Okay, so here's the bigger picture. Okay, so please don't be frustrated. Be patient, okay? Because it is a journey. It's not a it's not like a magic bean, okay? That once you take it, you get well already, okay? Cancer shouldn't be approached like that. It should be approached as a lifestyle, okay? Yeah,
You know,
have
Doc,
to live properly or live correctly.
thank you for sharing your cancer journey, and it really hits the point because I was talking to this breast cancer survivor, but she was again wearing a bandana, and because she had a recurrence, and she looked at me and she said she didn't understand, Doc, which is why thank you for sharing your cancer care journey. She said she didn't understand. She said she went for a chemo, she did her surgery, and she was cancer free, and the cancer came back. So she asked this question. She said, what did she do wrong? What did she do wrong? She's so frustrated. She said, what did I do wrong? I thought everything was okay. And I looked at her, I said, Tita, you didn't do anything wrong. So don't be angry with your uncle, don't be angry with yourself. You didn't do anything wrong, but I think you didn't do enough.
Yes, that is the correct answer to that question. You didn't do enough. Okay, so that missing part is the lifestyle modification. She should have been eating well, properly, exercising, sleeping well. So these factors. Okay.
So Doc, I think one thing that this is to address our viewers who prefer natural. There are many viewers out there who say, I want to treat my cancer naturally. And my stance has changed a little. In the past, you could fight many flu or viruses naturally, but today our flu and viruses are evolved. It's like
I get what you mean.
humans are smarter, but so are the viruses and the bacteria.
Yes,
So so I used to think that, I used to ask myself, why would an oncologist prescribe poison to you after you're cancer-free? Because there's, they will say, preventive chemotherapy, right? It's like you're cancer-free, but we're gonna give you a few shots of chemotherapy just in case. And 2 or 3 years ago, I said, you know, that onco is just being mean, you know, he's just being mean. But recently, I've also met friends who avoided this preventive chemotherapy to sweep up the remaining cancer cells. And what happened was that the cancer came back with a vengeance. You know, as we mentioned earlier in this program, metastasized the brain and the lungs. So, Doc, it's true, right? Chemotherapy is damaging.
Yeah.
But why are you confident now that, you know, as damaging as it is, a person should go for preventive chemo? Because we have a way to protect them, right?
Yeah, we have simplynature-𝘂𝘶𝑚. So the main mechanism there, no, is, yeah, it's true. Chemotherapy, radiation therapy will kill off the cancer cells, but it also kill off the healthy cells or the good cells, right? So that's the reason why you get a lot of side effects, etc. But we have a way so that your body recovers much faster, which is simplynature-𝘂𝘂𝑃ARs, because it stimulates the genes, it's a gene activator in such a way that it promotes cell differentiation. Now, it's a mouthful, no? It's a medical term, but cell differentiation just means that it enhances the growth of cells, of healthy cells, okay? So that the healthy cells would function the way it's supposed to be, okay? And not be a cancer cell where it just spreads relentlessly, okay? So it's basically the mechanism behind it. So in each cycle, in each session that you undergo chemotherapy or radiation therapy, yeah, your cancer cells gets killed off, your healthy cells gets killed off, but you have 𝘂𝘂𝘂𝑃ARs, simplynature-𝘂𝘂𝑃ARs, which makes your body recover much faster. So you are ready for the next one. So in the bigger picture, it will be easier for you to finish that chemo or that radiation therapy sessions, okay? The side effects will be less. Okay, so that's mainly the reason. Okay?
Yeah, and this is where I would really want to encourage everybody, especially if you have a more aggressive type of cancer, not to now that we have simplynature-𝘂𝘂𝑃ＡRs protocols, you can choose to do that preventive chemotherapy.
Yes.
With the peace of mind. It's like this, right? Imagine you want to clean your plate, but you don't want to use detergent because you are afraid the detergent will dry your hands. Yeah. But you know without the detergent, your plate is not going to be very clean. But what if I give you a pair of yellow gloves, right? You wear the glove, you're no longer afraid of the detergent drying up your hands. So you can safely use the detergent to really clean up your plate. That's what simplynature-𝘂𝘂𝑃ARs brings to the table in your cancer journey. So for those of you who have aggressive tumors, aggressive cancers where it's not a good idea to not do the preventive chemo because your cancer is so aggressive, if you didn't kill it completely, even if you just leave a few behind, it'll come back with you at a vengeance. Now you can safely take that option because you can take the liquid extracts while you're going through chemotherapy, and that will protect you from the side effects of chemotherapy and give you the peace of mind to prevent a recurrence for aggressive cancers. So I really wanted to put that out there. It was a strange journey from me, from being someone who told people go natural, to now saying that, you know, it might be a good idea for you to really look at the chemotherapy.
Yeah, get the best of both worlds.
Now we can get the best of both worlds, and I think that's what we want to end with for our guest, our sharing or lecture today. Get the best of both worlds. Don't just go only natural. Don't just go only convention, because each has its limitations. Now with simplynature-𝘂𝘂𝑃ARs and with us here, you can really get the best of both worlds and not have that cancer come back in your life. So without further ado, let's go and answer all your questions.
Thank you, Doc and Sir Shyan. So, wherever you are in the 3 stages of the cancer care journey, whether you are in phase 1, which is the early phase, or phase 2, which is the treatment phase, or phase 3, which is the relapse prevention phase, let us know in the comment section below so we can guide and empower you to take control of your health. Questions are very much welcome. Just type them down also in the comment section below. Kahit Tagalog, okay lang po. So first, I would like to shout out to our avid viewers, Miss Lily Luningyo from Kuala Lumpur, Malaysia, Victoria Charlie, Felicissima Siman, Babs Agot, Flor Mendoza from Bulacan, Edna Alarcon, and Miss Janet Koo representing Child House. Our best regards po to Miss Jessa Malate. Webinar is not complete without you. I would also like to greet our new viewers, Jacqueline Teo from Sarawak, Malaysia, Nancy Kim from South Korea, Ina Tanchico from Cabuyao, Laguna, Meredith Tipangam from San Fernando, Pampanga. Ayan. And to answer your questions, in this modern world filled with noise of different health opinions, trust the ones from the experts. May I call on Mr. Shyan Lim and Dr. Jansen Calalan.
Thanks, Jen.
Sir Shyan.
Thanks, Jen. Hi, Doc.
Hello, everyone. Hello, Shan. Hello, Jen. Happy to be here.
Oh, we have viewers from South Korea. So I just want to let our South Korean viewer know that I think in Philippines, a lot of Filipinos and even Singapore, we love to watch Korean dramas. And Ms. Bev is a super BTS fan. So thank you. And we have people from Ireland. Did I hear correctly? There's a viewer from Ireland.
Yes, sir.
To share with all our viewers, no matter where you are, both Simply Nature consultants like Ms. Jen, who is a registered pharmacist, and Ms. Sheila are always available to assist you in any of your questions. So feel free to ask questions on our Simply Nature Facebook chat, right? Any questions you may want to know from how to buy the products or any questions about protocols. And also, through the wonders of the technology, and it's, you know, teleconsult is one of the best ways for cancer patients or any patient to have a consultation when you don't require any diagnostics. Like, for example, that you don't need to do any like blood drawn or anything. So that consultation is definitely also available for all the way in South Korea and even in Ireland. As long as you have a good internet connection, if there's any questions that you may want, you can always consult Dr. Jansen through teleconsult. So not restricted by geography. And also no restrictions on any of our questions tonight. It is the Ask Me Anything segment. So Dr. Jansen, any words before we start with our first question?
Hello, everybody. So I hope you learned a lot in this webinar tonight. So just keep on asking the questions and we'll try to answer all of them as much as we can. Okay, so yeah, let's get started.
Yeah, let's get started.
Okay, I can see a lot of questions coming up and thrown privately. So let us start the live AMA or Ask Me Anything portion. Our first question coming from Miss Meredith Tipangam. I am total thyroidectomy and I undergo once in RAI. Right now, I am on lifetime med levothyroxine, is it? And it's been a year so far, so thankful kasi mababa ang TG and anti-TG. Can I drink PPAR?
Yes, definitely. But the PPAR agonist that you will take would only be very minimal. It would be for general health, basically. Okay?
Yep. So definitely encourage everyone that it's so important to make sure that you're doing something to supplement yourself. Okay, this is actually something in modern day proven already. All right, our modern day diet is not going to be sufficient enough to keep you at the prime of your health. So many articles on YouTube, on radio shows, on news channels about the different types of approaches to supplementation, from taking things like ginger, turmeric, all right? That's always our preference, me and Dr. Jansen. You know, not only Simply Nature-𝘂𝘓𝘂 tablets, we would always encourage anyone to take supplements that are wholly natural, plant-based whole food supplements like turmeric. Those of you who are in Asia and especially in Philippines, you might be familiar with malunggay, all right? Okay, things like that. We prefer that over purely, multivitamins of traditional things in that area that you see in the 80s. Right now, in modern times, we do prefer to take totally natural supplements instead of those synthetics with lots of binders and so on and so forth. All right. Yeah. Go, Jen. Next question.
Okay, next question coming from Mavs Agot. Doc, ang tanong ko po sana, my question is, what are my chances? I already operated last January 16, 2023, and I didn't proceed with the treatment plan of my chemo and radiation of stage 3 adenoid cystic carcinoma maxillectomy procedure. But now I'm on PPARs and other food supplements. So what are her chances?
I cannot really say for sure because I do not know your history. I do not know your laboratory result. I do not know the status of your body is, how healthy you are. Okay, so I cannot really say for sure. Okay, however, for that matter, if you just underwent a surgical procedure but did not undergo the recommended chemotherapy and radiation therapy, then the chances of the cancer returning is still high. Okay, so I'll leave it at that.
So, Doc, specifically for this patient, and it's true. I mean, in our program for all cancer patients, we did explain. You can take a look at our YouTube channel to find older programs, maybe any topic on chemotherapy. You will understand why we support, okay, for most cases, okay, to undergo chemotherapy as a safety measure to clean out any remaining cancer cells in your body. But we also remember, we do not recommend just going for chemotherapy alone, because all of you are correct. You are concerned about the negative side effects of chemotherapy. So while undergoing chemotherapy, please, it's so important to be on protocols that strengthen your body and reduce the damage of chemotherapy. So though me and Dr. Jansen are supportive of chemotherapy, we are not really supportive of chemotherapy just alone. Okay, you got to make sure you eat right while you're going for chemotherapy. You got to make sure you supplement and strengthen yourself before you go for chemotherapy. You also got to make sure that you're suitable for chemotherapy. If all these conditions are met, then it should actually improve your success rate in staying cancer-free if you already finished your surgery and treatment, or it will be a very powerful treatment protocol for you. Okay, so Doc, back to the question for this particular viewer. She asked what are her chances. So obviously, Doc, in order to know, even though she's taking PPARs and natural supplements, in order to know how she's doing, what kind of scans should she do? And even without a consult, what do you recommend as a minimum? Every how many months she should go and scan, and what kind of scan, and to know whether she's progressing well or not?
Yeah, the number one scan that I would request if I were your doctor would be a CT scan. Okay, CT scan or an MRI. Okay, to know for sure the status of the anatomy of your of the tumor, of the area where the tumor grew. Okay, but just to give you an idea, these two modalities can be requested by your doctor. For CT scan, it can be contrast enhanced, okay, just to know for sure if there are any enhancing lesions. Okay, enhancing lesion, if there's a finding, such a finding in the laboratory result, then that means there's a tumor there. Okay, so yeah, those are basically the two scans that I would be requesting. How often should you have it? Depends on the treatment that you're undergoing. Depends on the goal really of the treatment. Okay, so it can be every 6 months, it can be once a year, it can be quarterly. Yeah.
Oh, okay. So to the viewer and other viewers, even though you are doing natural therapy, doesn't mean you don't go for scans. Okay, you got to know whether your natural therapy is working, diba? So you got to make sure that, as Dr. Jansen mentioned, the time frame that he said, and go for a CT scan. So you got to check whether the tumor is getting bigger, smaller. Now, if you're on a natural therapy or any therapy, if your tumor is not getting smaller, okay, don't feel sad straight away. The good news is the tumor is not growing bigger. Okay, it's just like a car. When you do a U-turn, you have to slow down first before you can turn the other direction. So before your tumor shrinks, it has to first stop growing. So go for scans, okay? Now, Doc, I just want to ask you, many people who choose natural, because they choose natural, they don't go to the hospital to see an oncologist, right? So naturally, they don't end up going for any scans, just like our viewer. Many patients are like a third stage cancer patient or second stage cancer patient. Maybe when they go for natural therapy, they feel stronger. They feel not tired. They feel that their color looks good. They are strong. Just because, can you tell whether your cancer is getting better or worse from your feeling? Like you're strong, you can walk better, you're more alert. Is that a good indication? Is it safe to say that my cancer is getting better because I feel better?
Okay, not really. Okay, so the general feeling that you have or whether or not your cancer is getting worse or improving, it doesn't correlate. Okay, because why? There are patients who don't feel anything at all, but their cancer is getting worse. It's getting larger and larger and larger. Okay. However, if your general feeling is getting worse, then obviously you are on a worse state than before. Okay. Will your cancer, the status of your cancer, be better or not? Depends. If you just recently had radiation therapy or chemotherapy, definitely you would feel much worse than before. However, the status of your cancer would definitely be treated. Okay, so it doesn't correlate. Okay, it doesn't. There's no. Doesn't correlate. However, again, the general feeling of fatigue, malaise, of course, with those negative health indicators, then we can surmise that your body in general would be worse off than before. It can be because of the cancer, it can be because of the treatment. Okay?
Jansen, if you are naturally, that means you're not going for chemotherapy or immunotherapy, not taking any drugs. If you are just taking supplements and you are feeling weaker, then definitely that's not a good sign, right?
Yeah, definitely not a good sign. Yes.
Yeah, because there's no side effect from any chemotherapy or anything. So if you are using only natural treatment and yet you feel yourself getting weaker, that's not a good sign. All right, that's not a good sign. That will be a sign that you should go and see your doctor. Now, if you're on chemotherapy and you feel weaker, that's normal because you are on chemotherapy. Okay, but many of our chemotherapy patients, when they are taking PIPA protocols, they actually feel strong. Later, I will go and find a picture of Dominic before and after chemotherapy and share screen with you guys, and you'll be able to see what I mean. All right. So again, to this viewer, when you're going natural, it's good news that you're feeling stronger, but it doesn't necessarily mean that your tumor is shrinking. Okay. So you still need to go for a scan to totally know whether your natural protocol is working for you. So go for the scan. If your tumor and your cancer markers are down, then you can continue with your natural treatment and you can be confident that it is improving. All right. So remember to go for your scans. And if you're not sure what scan to go for, you can go for a consult with Dr. Jansen. You don't have to go all the way to your hospital, all right, to meet your oncologist, wait 4 hours, right? You can just ask Dr. Jansen to what kind of scans you should take, and then you can talk to him whether you can let him see your scan results first before you need to go and see your onco, or he might ask you to go and see your onco straight away. All right. So those are your options. Okay.
Okay. For those of you who wish to have a consult with Dr. Jansen Calalan, The link to schedule an appointment is in the description box and comment section below. Our pretty healthcare specialist, Beth, will reach out to you shortly. Moving on to the next question from Miss Charlotte Asinta. Sir, what are the signs and symptoms of cancer and what are their possible complications?
Depends
The
on
broad.
where the cancer is. Okay, depends on where the cancer is. But in general, that would be weight loss, unintentional weight loss. What else? Yeah, I think that's the most common symptom among cancer patients. Yes, it's an unintentional weight loss. But the rest of the symptoms would have to depend on where the location of the cancer is. If it is a solid tumor, if it is a blood tumor, then your immune system might be suppressed. Okay, so if it is suppressed, then you'll have frequent cough and colds, yeah, frequent viral infections, even bacterial infections. Okay, these things. Okay, so again, depends on where the location of the cancer is.
Doc Jansen, I wanted to ask you this question. You know, I remember speaking to you, you say that actually most cancers are not detected by the oncologist first. Most cancers are first discovered by family doctors. So that means you go to a normal family doctor and then your symptoms make him suspect that you have cancer. So, Doc, I want to ask you this question. For detecting like cancer, if someone like one of our viewers is worried and maybe he or she is not familiar with any family doctors that they're confident in, if they do a teleconsult with you and tell you why they suspect that they might have cancer, would you be able to do a good diagnosis, or do they actually need to go to a physical family doctor to be able to know whether their fears of cancer is real or not?
Okay. Here's how we diagnose, no, in general, illnesses. With just your history alone, 60% of the diagnosis would have already been made. Okay, the physical exam would comprise 30%. Okay, of the diagnosis. The 10% would come from your CT scans, your blood works, okay, your imaging studies. So basically, 90% of the diagnosis would have been made already with just history and physical exam alone.
So,
okay?
Doc, that means since you say about 60%, so if a person is wondering should they make a trip to the hospital or their clinic, they can first decide to just have a consult with you. And you will probably tell them, okay,
yes,
it's good enough chance you need to go to the clinic, or okay, no, don't worry. You don't need to worry. Okay,
precisely.
So okay, that's an option for many of our viewers, even those overseas, right? Because I know in some countries, it might be very expensive to even step into a clinic, or, you know, we have many overseas workers, and being in a foreign country as a foreigner, it's not so convenient to step into a clinic or hospital. So you can always make a consult with Dr. Jansen. He can review your medical history, ask you some questions, and to know whether, okay, you know, your suspicion is real enough that you should make a trip to the clinic to confirm, all right? Or he may already be able to give you an answer during the consult. So I think that's very useful for everyone, because I know everybody who is afraid usually just pretend and then go to sleep, okay, and forget about it. Don't do that. Just a simple consult will allow you to sleep well. Okay. Then the other thing is, if you are ever worried that your health is not doing well, let me recommend to you, you can start with a simple strengthening of your overall health with the 𝘂𝘶 tablets. All right. Just type in that you're interested to find more, and Sheila or Beth will get to you. All right. Thank you. Next question, Jen.
Thank you. Moving on from Mr. 𝘬𝗎𝘆𝘆𝑜𝑏𝑢𝑠. Does the Wilms tumor is so aggressive cancer?
Not really. It's not aggressive. It's not. Wilms tumor is also known as your nephroblastoma. That's the most common tumor of the kidney among kids. Okay, so it's not an aggressive tumor, and the survival rate is very high.
Oh, good
And,
news.
if you anybody can do a Google search nowadays, right? So if you just Google search Wilms tumor survival rate, you'll see it. Okay, it's more than 90%. Okay,
Wow.
even for stage 3. So yeah, it's not that aggressive, okay, compared to the other ones. As long as you get treated, of course. Because if not, then of course you risk it, progressing to 4th stage. Then for all cancers, if it's 4th stage, then the prognosis is not good. Okay.
So even for cancers, they are very treatable. Don't allow it to reach the 4th stage, which means it has spread to other organs in your body. Then it's much harder to treat. So for this viewer that asked, stage 3, so make sure you're on treatment right now, right? If you're on treatment, you need support, just type into the chat box. You want supplementation support, type into the chat box. If you want to have an additional consult with Dr. Jansen, also indicate in the chat box.
Okay, next question from Miss Aini. Good evening, Doc. What is the meaning of metastasis due to cord compression? Because my mother has lumbar scoliosis fractured and her stomach is heavy. It's hard for her to, bowel movement. She needs to take lactulose so she can push it out. And she was diagnosed with cancer this March 2023. And she was suddenly couldn't walk and became bedridden. And her whole body is itchy, especially at the back.
Okay, metastasis, it's not metastasis due to cord compression. It's cord compression because of metastasis. Okay, so with metastasis, this is a spread of cancer to the rest of the body, usually to a distant organ. And for her case, the tumor or the cancer metastasized or spread to the spinal cord. If the cancers spread to the spinal cord, then of course the cancer, that metastasis can still grow because it's a tumor. Okay, it's an extension of the tumor, so to speak, distant extension. No, so with it growing, with the size growing, no, it can compress the spinal cord. Now, if it compresses the spinal cord, then the electrical signals flowing inside your spine can be interrupted. That's why she has scoliosis because of muscle weakening, and also the fracture is because of the bone metastasis, no. And the other problems like difficulty in bowel movement, that's also because of the cord compression, because of the lack of nerve signals that's flowing in the spinal cord. Okay, that's why she needs lactulose. And the other ones, the itching is actually peripheral neuropathy, also because of the spinal cord compression. Okay, yeah, this is what it means. Okay.
Oh, Doc, many of your patients I know because sometimes I talk to your HCS Beth and also our own experience with cancer patients. So patients like this viewer's mom, who is bedridden, they see really good results with simplynature-𝘂𝘶 liquids, right? Just to give them back strength. We're not talking about the cancer now. We're just talking about recovering some strength to be able to sit up and move up. So any advice to this particular viewer? What should she do at this point? Or if she's already going for the normal oncological treatments, what can she do to strengthen her mom and to make those treatments more effective, just like what you shared during your discussion earlier?
Yeah. Okay. So if we're talking about just to strengthen, then definitely physical therapy, because if she doesn't move, no, then you risk her muscles shrinking further in size, which will complicate her movement even further. Okay. Another one is to consider release of the spinal cord compression, if it is surgically possible at all, and if the surgeon is brave enough to do it. Okay, because this is a very sensitive surgery. It's a very difficult surgery. Okay. What else? What else can you do? No. Actually, options are very limited at this point. No. I'm trying to think of anything that I can give you right now. But so far, yes, physical therapy would definitely help. However, for physical therapy, um, exercises would still be very limited because of the cord compression. Because if there is a wrong movement or if there is a wrong exercise that was done, then you risk severing the spinal cord completely. Okay?
Wow.
At that level. So physical therapy will help. However, the therapist would have to be very careful in moving. Okay,
Okay.
in moving the patient. What else? Aside from surgery, really very limited at this point. Even the PPARS liquid, I doubt that it can it can help probably just to make her a little bit more awake, perhaps, but to let her walk again, it would be impossible. The spinal cord compression has to be released for that to happen. And if it is released, the question is, the nerve would the nerves of the spinal cord still be intact? Because if the nerves were damaged already significantly because of the compression, then even if we release the compression, then the problem would still remain because the nerves themselves are damaged already. Okay.
Hmm.
Yeah.
Again, for this particular viewer, your mom, even though it's a difficult situation, there are always still things, Hail Marys that you can do. Like when I say Hail Mary means since the doctors have shown what are the limitations, then based on that, you can then do approaches like, for example, like Doc said, Simply Nature PPAR liquids, just to see if something out of the ordinary can be done. But in that process, please do things which are safe, right? So don't use unusual, unproven medical therapies or natural therapies that might make things worse. Okay, so you can always explore. You can always have a consult with Dr. Jansen and explore what other supplementations you can. Yeah,
Yes.
on my side.
Yeah.
Yeah, on my side, I will tell you, speak to our specialist and just on the chat, and we can see based on both financial and your case whether it's PPAR powder or PPAR liquid, and then observe, right? Since it's something that we're doing, we're not sure, but there's no negative side effects, and anyway, it will help her with her other things like her metabolic processes, strengthen the other organs as well. All this will definitely help her in her fight against cancer. And then observe for improvement. If there's improvement, then we can double down on this approach. Okay? Yeah. Just wanted to be, because Doc, you were very serious.
Yeah, because the question is also very serious. So.
I know you're really serious.
Yeah.
But in the process, to all our viewers, we have seen cases, and the most recent one is, of course, my friend, Ms. Zaida, who was actually sharing her testimony in the beginning of the program before the show. When I first saw her, because of our knowledge, I knew how difficult it was, right? I really just know how difficult it was. Her breast cancer had spread to the brain, multiple tumors in the brain. So definitely it was something very difficult, not very promising. But the good news is now she's in total remission. She's clear, okay? She's clear, she's doing well. So I would like to still end on that positive note that when I saw Zaida, I smiled and just told her, yes, let's go, because there is that chance. And we start from there. All right, we start from there. Jen?
Thank you, Doc. Thank you, Sir Shyan. A follow-up question from Ms. Meredith, who had thyroidectomy. Will PPARs affect my levothyroxine?
No, it won't. It doesn't have any interaction with levothyroxine. Okay.
And yes, it was also clinically tested against oxaliplatin and cisplatin, which are the common platinum-based chemotherapy. Okay, next question coming from Julie Roldan. Doc, I want to ask, if once the cancer spread to the bones, can it still be treated?
It can, definitely can, no? However, I will ask again, what kind of cancer is it? Because if it is thyroid cancer, which is spread to the bones, then definitely yes, can be treated. Okay. If it is breast, for example, or prostate or colon cancer that has spread to the bones, then it would be very difficult. Okay, to remove it or to eliminate it. More often than not, it won't. Okay. The tumor or the tumor that went to the bone, no, would either eat away the bone, so that it is left okay, eaten. Okay. So yeah, even if you remove the tumor, since the bones are already, have bits and pieces eaten off, then you're left with brittle bones. Okay. A more brittle bone, no? Can you rebuild it? Yes. Oncologists actually give you medication to rebuild the bone, okay, to help mitigate bone loss because of the metastasis. So definitely there's something that we can do. However, again, bone metastasis is a very difficult situation to have. Okay, and more often than not, the treatment, although we have treatment options, sometimes the treatments, it's also a probability whether or not it can work or not. No, really depends. And more always, no, the type of cancer is important. So I need to know that, so I can answer you properly. Okay. Yeah.
Okay, thank you, Doc. Okay, next question coming from Miss Teresa Jimenez. Hello po, I'm a breast cancer patient, stage 3. I take PPARs already, but my tumor popped by 2022 and my doctor advised me to take radiation to stop the bleeding, and it already stopped, congrats. And now I'm undergoing chemotherapy injectable. Is it okay that I can take also herbal medicine or natural medicine again? Thank you.
Yes, actually you have to consider it. Because the herbal medications, but of course you have to double check, no, if it can interact with the chemotherapeutic drug. Because if it does, then don't take the natural or herbal treatment. Okay. But for that matter, don't focus on herbal supplements just yet. Focus on eating the proper foods first. Okay, because the herbal supplements, what are they? They're herbs. What are herbs? They're plants. Okay, so eat plants. So don't focus on the herbal supplements just yet. And if you are trying to choose which herbal supplements that you would want to take, always choose the whole food form. Okay, your malunggay supplements, your what's that, mangosteen supplement. PPARs can also be one because it's microalgae. Your garlic supplements, turmeric supplements, these supplements, no, you can consider taking them. Okay. However, again, don't rely on those supplements. No, you have to finish your chemotherapy. Yeah, you have to finish your chemotherapy. So if you're wondering which supplements that you might help, then you have to go for a consult so I can make the proper recommendation, because I do not know what kind of chemotherapy medication you're even receiving. Okay.
I want to make a comment because I'm not sure what as a viewer you meant by herbal. Maybe because I'm Chinese, the first thing when you say herbal, I think of Chinese herbs. Okay, so first of all, I would caution anyone who has cancer to just take off-the-shelf Chinese herbs. Okay, I think that you will be placing too much faith in off-the-shelf Chinese herbs, because Chinese herbs are very specific. They are also like Western drugs. That means each have their specific functions depending on the body condition. So if you want to take Chinese herbs, please don't just buy off the shelf because you have cancer. Go and see a proper licensed TCM, okay, traditional Chinese medicine. So go and see a properly licensed doctor who will then be able to make sure that what you're taking, the herbal approach, will be correct. And let the doctor know also what treatments you're taking from your oncologist. Okay. And also in the process, I think sometimes I also know of some patients that tell me when they go and see the TCM tell them don't take chemotherapy. Okay. And then as a patient, you get confused. I just want to share with you, when you go to China, okay, in China, they do chemotherapy and also TCM and acupuncture all at the same time, okay? So if your TCM is very anti-surgery and chemotherapy, I would suggest that you go and look for, you try another few different types of different doctors, okay? Because in general, if today's modern TCM doctors are not anti-surgery, not anti-chemotherapy, not anti anything at all. They will tell you when they don't think your body is strong enough to take chemotherapy, for example, but they won't really, just go so much against it. So also be careful, because again, I just want to caution one thing: Chinese herbs are also, they are basically natural drugs. So they do have contraindications. If you're in certain conditions, you cannot use certain Chinese herbs. So please be careful. But you can always use the whole plant-based whole food herbs, like what Dr. Jansen said, things like malunggay, turmeric, all that is great. And of course, Simply Nature 𝘴𝘶𝘴𝘆.
Of course. Okay, next question coming from 𝘗𝗶𝘄𝑚𝑠. Can a 4-year-old take 𝘴𝑃𝑎𝑟S tablet as her supplement or vitamins? How about the dosage?
Yep. Okay, you want to take it?
Yeah, I'll take it up.
Yeah, okay.
Definitely yes, and I can tell you from personal experience, all my family, like my niece and nephew, they grew up on 𝘴𝑃𝑎𝑟S tablets. All right, from age 3 years old, they were already eating. And my nephew, who is the most disciplined, no break from 3 years old until he's 16 years old now. He tops his school. He's the class president, everything, just excellent. All right. So no issues at all. Every day when I go back to Singapore, I usually stay with my sister. So I see my nephew every day. He wakes up. My mom puts the 𝘴𝑃𝑎𝑟S tablets on a spoon for him already. So he's been taking it from 3 years old all the way until now. So 3 years old he's been taking it for 13 years. And the important thing, if my sister is watching, I want to say, sister, you have not paid for any of the 𝘴𝑃𝑎𝑟S tablet that my nephew is eating. Okay, it's always been complimentary from me. Okay, yeah, but yes, you can. Okay, for dosaging, good news to all those whose kids are taking 𝘴𝑃𝑎𝑟S tablets. There is no limitation on the dosage. But normally, we go around, like, for every year old the kid is, you can take one tablet, right? So if it's 3 years old, 3 tablets is fine. It's fine. And how you do it for younger kids, you can always crush it and put it into their drink, right? If they're drinking Milo or what any drink that they take, or if they're okay, like my nephew, he just swallows it, or he can chew it. Our GM for our factory, his son can chew an entire bottle of 200 tablets in 3 days. Okay, so no side effects. In fact, another top scholar also in that one. So for all the kids, yes. And if your kid is not feeling well, for example, having some flu or something, yeah, this is going to be better than just taking vitamin C. Okay, it's going to be better than just taking vitamin C. You can always up the dosage to 5 tablets, 8 tablets. Okay, so basically you also notice once the kid crosses like 12 years old, his intake can be the same as an adult already. All right, so that's absolutely fine. And as you well know, our 𝘴𝑃𝑎𝑟S tablets actually contain CGF. If you remember, every expensive infant formula or toddler formula contains CGF. It's supposed to promote good growth of the kid. It also promotes brain development, the DHA and all that you see in your advertisement for formulas for kids, right? Yeah, you can find all that naturally happening in the 𝘴𝑃𝑎𝑟S tablets. Okay, so again, yes, take it. It's a good supplement for them when they're not feeling well. And another good thing that we have direct experience, kids who have dengue fever, you know, taking 15 to 20 tablets, micro tablets during this time. So you split it 10-10, right? Does help the dengue recovery very, very quickly. You know, so it's very effective for that as well. So all that, okay? So the dosage is 1 tablet for every year old they are. So if they are 6 years old, they can take 6 micro tablets, all right? So basically, once you hit like 12 years old, you're basically up to an adult's nutrition. And there are so many positive effects for them. So yeah, the more the merrier.
Thank you, Sir Shyan. A related question coming from Miss Gloria Armado. Good evening. The 𝘗𝘓 tablet should be chewed first before swallowed?
Ah, depends on who you ask. Okay, no. Okay, definitely. Okay, let me share with you. Okay, there's a benefit when you chew supplements. Okay, not only 𝘗𝘓 tablets, even let's say you're taking turmeric or anything. Why? Because under your tongue, your body can actually absorb certain amount of nutrients directly into your bloodstream. Okay, so the term that people who do natural therapy, they call it sublingual, right? So so that's the advantage of chewing. Okay, now if you like the taste, chew. If you happen to have a husband who doesn't even want to eat vegetables, don't try and persuade him to chew. He will not even take anything. Just ask him to swallow, all right? My personal, I swallow. Okay, I swallow. My wife chews. Okay, there's an advantage of chewing. Your teeth also become whiter. I don't know why. If you ask me, I don't know why. I'm guessing that the 𝘗𝘓 tablet is slightly alkaline in nature. So maybe when you chew it, it reduces the acidic effect of like your coffee and everything. And that's why it doesn't damage your teeth as much. And it's also true, if you have a toothache, if you chew the tablet directly near that area, because if you chew on your toothache, it's going to be very painful, right? The pain actually helps to subside. So I think that also reinforces the idea that the alkaline nature of the tablets might be helping to neutralize whatever is hurting the enamel and making your nerve sensitive. Okay, so chewing has the benefit of slightly better absorption. Okay, but you still get the same benefits by drinking, by just swallowing it. Okay, but chewing it does make it faster and a little bit more direct. Yeah.
Thank you, Sir Shyan.
I just want to ask, Doc, when you eat it, do you swallow or chew?
I prescribe it always chewed.
Oh, okay. What about you?
Always chewed.
Always chew. All right. So I assume you also chew lang.
Yeah.
Okay, that's why your teeth is whiter than mine. All right.
Okay, next question coming from Miss Tete Chiyoko. Is there any specific menu while ongoing chemo? Foods to eat and not to eat while on chemo? Thank you.
I think Chef B should have been here. Well, anyway, menu. Okay, I won't give you a menu, but I'll tell you what to eat. Okay, so eat fruits, vegetables, whole grains, beans, nuts, and seed. Okay, those are the food categories that you should be eating regularly. Okay.
So again, Doc, what is it? Beans, nuts,
nuts, and seed.
Seed. So seed like flaxseed.
Yes, like flax seeds, chia seed, sunflower seed. Yeah, but for cancer, flax seed is the one that I always recommend. Okay.
I want to recommend flaxseed a lot because it's very tasty. It tastes like crushed almonds. And it's very nice to sprinkle on top of, for example, your cereal, oatmeal. Okay, it's very nice to sprinkle on top of your rice. Those of you who like to eat Japanese rice, you know, the Japanese and the Taiwanese, they sell these little packets of flavor, right, that you sprinkle over plain rice. So if you sprinkle flaxseed over plain rice, it actually adds a very nutty flavor. So it's nice. So just go to your local organic store, you should be able to find it.
It's good. Next question, a follow-up question from Ms. Meredith Tipanga. Can I make 𝑃PARs as my supplements right now? I already changed my lifestyle to low carb and no sweets, but my problem right now is it's hard for me to lose weight. So will my weight increase if I drink 𝑃PARs?
Oh, let me answer this. Okay, the answer is yes, all right. When you take 𝘂𝘓 tablets, it's one of the best things, especially for vegans as well. I use it when I go do fasting. Okay, when you take 𝘂𝘓s, will it help you to lose weight? The answer is actually, in general, yes. When we did a press conference, this one is just an analogy, I guess a story. When we did our press conference to announce that 𝘂𝘓 was effective for the immune system, the reporters came, right? So when the reporters came to the press conference, they went home with a free bottle of 𝘂𝘓 tablets. So what happened after that is they came back to buy more because they realized that they slimmed down. Okay, they slimmed down. Now, I don't want to go into the science of it all, but if you study nutrition, then it actually puts your body into a Krebs cycle instead of Corey cycle. That's one. The other thing is that very important for those who want to lose weight while eating 𝘂𝘓 tablets. One of the common things that happen is when you first take 𝘂𝘓 tablets, some of our patients and clients will tell us that their appetite increase. Okay, their appetite increase. So what happens when your appetite increase? You eat more. So when you eat more, you definitely will not lose weight. Okay, so what's happening? It's supposed to help you lose weight. Why is your appetite increased? Okay, this is very important for those who want to lose weight. If you take 𝘂𝘓 tablets and your appetite increases, the solution is to eat more 𝘂𝘓 tablets. Okay? Let me explain very simply. What happens is that when you eat 𝘂𝘓 tablets, it will contain some of the nutrients that your body is missing. Because your body is missing these nutrients, it will tell you that they want more of it. And the way that happens is that your appetite will increase. So in general, when you take 𝘂𝘓 tablets, your appetite should actually taper down. Okay, if the reverse happens, that means you feel hungrier when you eat 𝘂𝘓 tablets. Then for the next 2 to 4 days, eat more 𝘂𝘓 tablets. Every time you're hungry, take another 10 𝘂𝘓 tablets. So what will happen is whatever deficiency you may have in your nutrients will be covered. Then after that, you won't feel the increased appetite. In fact, it will be reversed. Your appetite will be curbed a little bit. But the weight loss that comes from 𝘂𝘓 tablets is not so much appetite suppressant. It's really because your body will burn the energy that it takes more efficiently and the correct physiological processes. So that results in more calories being burned. And if you burn more calories, you will lose weight. All right? Yeah.
Okay, we've been talking a lot about 𝘂𝘓s. Ms. Marie Encarnacion Mendoza is asking, please define 𝘂𝘓.
Okay. Doc, finally, there's an episode that I talk more than you. Okay. What is 𝘂𝘓s? 𝘂𝘓s is peroxisome proliferator activated receptors. It's actually a cell microbiology term. It refers to processes in your body. Although we keep saying 𝘂𝘓s, that's just the name of the product. But the accurate term is that we are 𝘂𝘓 agonists. Okay, our product contains a catalyst, something that starts the 𝘂𝘓 process in your body. Okay, so what does the 𝘂𝘓 process control in your body? It is actually at a cellular level. It will start the engine. It will start the thing going that will regulate. That means it will make normal balance. That will balance your immune system, balance your metabolic systems, balance your inflammation response. Okay. So the more technical medical term will be modulate. It will modulate your inflammatory response. It will modulate your metabolic systems as well. It also helps with proper cell differentiation or delineation. So that means your cells develop correctly. Now that sounds so important to a cancer patient, right? Because for a cancer patient, your cells develop wrong. So 𝘂𝘓 agonist action actually helps your cells develop correctly. So which is why when you take it, your red blood cell, white blood cell count goes up. okay? Because it's so important that your blood stem cells in your bone marrow develop and mature correctly so that they become correct white blood cells and red blood cells, okay? So that's what 𝘂𝘂𝑝𝑎RS is. But on top of that, specifically when it comes to product, I will let you know right now, the best product that we have is actually the simplynature-𝘂𝘂𝑝𝑎RS tablets. That means it's the most basic product. Why is it the best product? In my opinion, because it contains all the nutrients. All right, but of course, for cancer patients and sick cases, you need the extracts, because what you really want is the 𝘂𝘂𝑝𝑎RS agonist. But if you are healthy or you're in maintenance mode, the best product is really the tablets, because it will also give you chlorophyll, it will give you a natural plant-based protein, it'll give you your minerals, your vitamins, even folic acid, which is why it's good for women who are pregnant. So it's really one of the best basic foundational supplements that you can get. All right, and I hope that answers what 𝘂𝘂𝑝𝑎RS is. If you want a very, very deep answer to 𝘂𝘂𝑝𝑎RS, please go to our YouTube channel and look under Doctor's Forum. So in those videos, I actually explain in a manner for doctors what 𝘂𝘂𝑝𝑎RS is and how does it work.
Yeah. Coming up is another 𝘂𝘂𝑝𝑎RS question from Ms. Arlene Arcagua. Hi, Doc. What is generally the role of 𝘂𝘂𝑝𝑎RS? Is it helping our body respond to chemotherapy treatment? I am on recurrence, breast cancer, now lung cancer stage 4. Currently on Halaven on my 5th cycle. How do I know if I take 𝘂𝘂𝑝𝑎RS and improvements are noted? Can it be attributed to the efficacy of chemo or 𝘂𝘂𝑝𝑎RS?
Okay,
Yeah.
I'll take this on.
Yeah.
Does it have okay, I'll return the question to you. Does it have to be chemo or 𝘂𝘂𝑝𝑎RS that makes you get well? As long as you get well, that's it. Regardless of what the treatment that you underwent is. Okay? However, here's the thing. Okay, the role of 𝘂𝘂𝑝𝑎RS in cancer care is this is also what third-party studies that have been published are saying. Okay, basically, simplynature-𝘂𝘂𝑝𝑎RS was tested on a chemotherapeutic drug named cisplatin and oxaliplatin. Okay, now these two chemotherapeutic drugs are known to destroy the bone marrow. Hence, your immune system going down, you develop anemia, and worse, you bleed. Okay, so they found that when they administer cisplatin or oxaliplatin together with simplynature-𝘂𝘂𝑝𝑎RS, the bone marrow is protected, or let's just say that the bone marrow toxicity is minimized. Okay, and that is not just true while you're undergoing the two chemotherapeutic treatments. It is also true when you have finished it already. So for patients who have finished their chemotherapeutic cycle, they are on that rest period, okay? Or they have finished all cycles of chemotherapy that was prescribed, okay? And their body is really damaged because of the side effects. Then simplynature-𝘂𝘂𝑝𝑎RS can help the body recuperate faster. Okay, so that is mainly the role. Now, on top of that, okay, that is the primary outcome that they were able to get. What are the other outcomes that they were able to find out? They also found out that simplynature-𝘂𝘂𝑝𝑎RS can induce apoptosis on cancer cells, meaning it can kill cancer cells. Okay, those are the secondary outcome. However, of course, what we know is that it can definitely help you finish your chemotherapy, okay, by making your body stronger. But here's the thing, okay, we have to know what kind of chemotherapeutic drug you're taking, okay, because some chemotherapeutic drugs can interact with the 𝘂𝘂𝑝𝑎RS, okay. It can neutralize the effect. So we have to know what kind of drug you're taking. So we have to be able to schedule the dosing of the 𝘂𝘂𝑝𝑎RS. Okay? So there you have it.
My turn to add, Doc.
Okay, yeah, go ahead.
Okay, so number one, I like what Doc asked. The first question is, does it matter which as long as you're getting better, does it matter which is helping you? Now I know what went through your mind. I need to know because they both cost money. So if I can
You want to dump one?
you want to drop one, okay?
I won't recommend that. I won't recommend that because there are also studies that have shown that PPAR agonist can make the chemotherapeutic drug more effective.
Yes. So here's the thing, okay? In cancer treatment, all right, almost never, I don't like to use such an absolute term as never, but almost never is cancer treated successfully one way. It's always you went for chemo and then you ate healthy as well, and then you were not stressed. So cancer is always a combination of things that allow you to be successful. And if you did chemo without PPARs, not very successful. You did PPARs without chemo, maybe also not very successful. You have progress in your cancer, but you're not totally cured. Now you put them together, you get very good results. So are you going to say which one is the one that helped you? They all work slightly differently, or not slightly. In this case, chemo and PPAR work totally differently. And they are attacking your cancer from two different directions, all right? Now, let me focus on something, all right? Since in your particular case, you are going through chemotherapy and then you take PPARs at the same time. So this is what I want to share with you. If you're taking chemotherapy and you're feeling together with PPARs and you are feeling okay, you can manage all the side effects, you are already getting the primary result that you should get, which is the PPAR is protecting your immune system, allowing you to finish your chemotherapy strong. And that's very important because after your chemotherapy, your immune system should be intact so that it cleans up any remaining cancer cells. Now, for sure, we know the liquid PPAR is helping your body to fight cancer, but we can't quantify which is doing more work. How much work is it doing compared to the chemotherapy? All right. We know for sure because people who don't take chemotherapy and just go natural, yes, the PPAR helps them and improves their fight against cancer. So the first result that you want to know so that you say, okay, I'm getting my money's worth is you're going through chemotherapy and the side effects is controllable, not so bad. You are already getting your money's worth, right? And you can also be confident it is also helping protect your immune system so that after chemotherapy, the chances of the cancer coming back will be less because your immune system is intact. And yeah, okay, I think that's my addition to Dr. Jansen's answer.
Okay, thank you, Doc. Thank you, Sir Shyan. Next question coming from Miss Claire Ong. Can dermoid cyst be dissolved by natural therapy?
Oh, dermoid cyst can only be treated with surgery, nothing else. Yeah, you know what a dermoid cyst is?
Yes, please share.
Cysts are in general liquid inside, right? Fluid inside. Okay, in case of dermoid cyst, first, where does it come from? It usually grows from the ovary, and inside it are mature cells. Not really cells, no, mature tissues. Okay, these are full-grown tissues. Okay, what are the full-grown tissues inside the dermoid cyst is? You have your brain tissue, you have nerves, okay, you have bones, you have teeth, you have muscle. It's basically an amalgamation of a little bit of everything. Okay, so in the medical literature, actually, it's we call that a teratoma. Okay, or if you take a look at the etymology, is it etymology? Etymology, right? Teratoma means it's a monster-like. Okay, it's monster tumor. Okay, so with that kind of terminology, monster tumor, then it's sort of like a it's monstrous, no? So typically we see you have your teeth, right? A teeth looks like a teeth. Okay, teeth looks like teeth, right? Brain looks like brain, no? However, for teratoma, it is a tumor wherein inside it are little bits and pieces of mature tissues. Okay? So if it's matured already, then that's not cancer. Okay? That's not cancer. Teratoma or dermoid cysts are actually benign ovarian outgrowths. Okay? And for that matter, that cannot be treated with chemotherapy, that cannot be treated with radiation. There's no supplements that can dissolve that. The only way to remove that is to take it out through surgery. Okay? Yeah.
Uh,
Thank you.
yeah, sorry. All right. Okay. Can I share screen, Junie? Okay. I just want to show everybody. I hope you can see on your screen right now. Yeah. You guys can see this, right? Okay. I want to show you because the question you asked was, I'm on chemo. Dominic. Look at this, this Dominic on his first day of chemotherapy. Usually, this is what you imagine a person looks like or a kid looks like after they go for chemotherapy. This is why everybody's so afraid of chemotherapy, right? You're saying that chemotherapy will hurt you. It'll make you weak. And this is the picture. Now, this is the picture of Dominic after chemotherapy. I'm pausing for effect. This is opposite of what we think, right? We usually think this is before chemotherapy. Then after you go for chemotherapy, you look like this, right? This is more what most people will imagine, but this is actually the reverse, all right? This is before chemotherapy. This is after chemotherapy. So Dominic, you notice his swollen neck, his lymph nodes actually subsided. He took one liquid extract before the chemotherapy. Then this was the first session of his chemotherapy. After 2 weeks, this is what he looked like. He was on chemotherapy and one liquid extract every single day. Now, after he did 38 sessions of chemotherapy and radiation therapy, okay, you saw he shaved his head. It's not because his hair dropped, because they shave the head of cancer patients just in case their hair drops, because it will freak out the child, right? If suddenly they wash their hair, then all the hair drops on their hand. So they usually shave them first just in case that happens. But you can see after 38 sessions of chemotherapy and radiation, you look, Dominic still has a good glow in his face. He's doing well. So this answers the question of that gentleman or the viewer that asked. So the effect that if you're on chemotherapy, the effect that you want to see is that you're going to go through chemotherapy very well, all right, from the 𝘊𝘆𝑠. And on top of that, for sure, it's going to be helping you fight cancer. But I wouldn't want to go and argue with the oncologist whether his chemotherapy is helping you more or our liquid is helping you more. I think I'll be very satisfied that your RBC, red blood cell count, is high. Your white blood cell count is healthy, so that you can continue your chemotherapy. The moment these two drop, you can't. So taking the Simply Nature liquid will keep you on track for your chemotherapy, and we pray that will solve the problem. And like Dominic, you will get well. And this is Dominic later. All right, this is Dominic. I think 4 years after his treatment. So there he is. Okay. Yeah. Okay.
Yes, Dominic is watching right now with me.
Okay, Dominic is watching, all right? Dominic wanted to be a policeman. I was so happy because then next time, if I get caught by a policeman for traffic, for speeding, maybe, you know. But later now he wants to be now he wants to be a scientist. You know, kids are always changing. Okay, so Dr. Jansen, you are laughing. Okay.
Okay, next question from Miss Delia Lorenzo. I was diagnosed with metastatic breast cancer in 2022. Can 𝘊𝘆𝑠 be used with palbociclib Ibrance?
Okay, with palbociclib. Okay, this is one of the drugs that you cannot mix both. Okay, however, here's the thing. For palbociclib or Ibrance, you take it for 21 days, then you rest for 7 days. During that 7 days, you can take PPARs, okay? Because the side effect of palbociclib is very similar to chemotherapy. However, here's the difference, okay? Since palbociclib is classified under targeted therapy, it only kills the cancer cells, okay? The rest of the healthy cells, at least, well, okay, I'll try to rephrase this so you get how it works in general, no? So, we have chemotherapy, right? If it's chemotherapy, then everything is destroyed. Cancer cells, healthy cells. For targeted therapy like palbociclib, it specifically target cancer cells plus a little bit of the healthy cells. So not all healthy cells will be affected, but some of it will be. So in terms of its side effects, it's more tolerable. Okay? So some common side effects of palbociclib would be nausea, vomiting, no, similar to chemotherapy. It can also affect your blood cells, your white blood cell count, your red blood cell count. Yeah. Okay. What will be spared? Okay. Usually you don't lose hair. Okay, with palbociclib. Usually you don't have peripheral neuropathy or that itching when you undergo chemotherapy. So that's not a very common symptom as well. Now, for that matter, PPARs will still have a role if you're on Ibrance. Okay. Usually, I prescribe PPARs during that 7-day rest period. And it depends, or the dose of the PPARs will depend on what kind of side effects you are experiencing. Okay? So still, if you want to try out Simply Nature PPARs, better go see me. Okay? Because I have to know what kind of side effects you have. I have to know the status of your blood count, the status of your cancer as well. Okay, and how many more cycles of Ibrance you're left with. But usually Ibrance therapy is years. Okay, yeah. There you have it.
Thank you, Doc. Thank you, Sir Shyan. That's all we've got time for today. I can still see a lot of questions coming in, but don't worry, we will answer each of your questions next webinar or via direct message. And we hope to see you all in our future webinars to come, same day, same time, every Thursday night at 7:30 p.m. For those of you who is confused of what to eat or what to avoid, we are going to tackle the role of nutrition in cancer management. And just before we say goodbye, kindly give our viewers your parting words for tonight.
Doc, you want to go first? Yeah.
Okay, I'll go first. So I just want to thank all of you, for attending our webinar tonight. It's been a wonderful audience. Okay, you've asked a lot of questions that made me think and made Chad think as well. Okay, great job to everyone. No, so with asking questions, not only you learn, but also the other ones who are watching learns as well. No, so keep on asking those questions. They're all wonderful ones. Okay, so one last encouraging word. No, if you're undergoing any kind of cancer treatment right now, whether it's conventional or whatever, don't lose hope because there's always something that we can do. Okay, no matter what kind of cancer treatment you want to undergo. Okay, so what's important is you just have to take that action. You have to take that first step. Okay, so don't be afraid. So that's it for me. So I'll give the floor to Shyan.
Number one, I want to thank Dr. Jansen again, and to all our viewers for staying with us all the way to 9 o'clock. And today's discussion was actually very short. So this AMA session was more than an hour long. So thank you for everyone. I especially enjoyed today because the questions were very specific. And I found that the questions actually led to answers that are very actionable. That means go for consult, continue taking your tablets. You can plan on taking liquid protocols, or you can, they all led to actions. And that's what we want to do every Thursday, give you answers that help you take action. And just as Dr. Jansen says, me and Dr. Jansen, we meet so many cancer patients. This Saturday, we're going to the child house. So we're going to see Miss Janet. And we see the kids there they are so brave. They're all cancer fighting kids, right? And they're so positive. So we have seen so many difficult situations, and yet there are always success stories. So I think this is where I want to leave you with. We hope that our answers tonight give you another avenue to explore how you can win your fight against cancer. And we look forward to seeing everyone next week again. Same time, new topic, but same time. Jen?
Yes, we're all here to invest in our health. So if you didn't know, for as little as 650 pesos, you can start your health journey with us. Thank you once again for watching Simply Nature webinar powered by SMG or Simply Healed Medical Group. Because your curiosity about your health condition and your victory over cancer and metabolic diseases is what keeps us going. Because here in Simply Nature, we are always with you from start to healing.
Yeah, just one check. What's the topic next week?
Oh, the topic next week is about role of nutrition in cancer management.
All right. So for everybody who wanted to ask what food to eat during cancer, next week is actually a super focus on that. All right. So prepare your questions. If any of you have your favorite foods and you want to know whether that's good or not good for you, you can ask us next week during the AMA segment. So again, have a great weekend ahead, everybody. Goodbye and see you next Thursday.
Thank you, everyone. Good night and God bless you all. Keep dry and stay safe.